Okay, shall we start then? Yes, not to lose our time. Probably then people who miss the beginning, they can watch the record. Yeah, do you agree?
Yes, that's right.
Okay, if you don't mind, can you share the possibilities for me to, yes, to show the screen of the new plans?
Yes.
And yeah. Thank you. Thank you. Then we will start. Good. So I would like to start with the 9 days treatment plan. Now I will make a bit bigger so you can see it in details. This is a 9 days plan, yeah, for autistic kids. And you can see that this plan, in comparison with the previous program, it is more intensified, and there are more stem cells procedures. Each line has the meaning how this dose will be administered. So, for example, here you can see that it is intravenous infusion and how many procedures is done, and the amount of the stem cells per kilo. For having more comfortable evaluation, you can see that the program is divided into 9 days. So each day is mentioned here, what it involves. And like in each clinic, the first day is, of course, as well lab tests and evaluation with the specialist, with the pediatrician and speech therapist, plus common lab tests are taken. They are complete blood count, biochemical test, coagulation, liver enzymes, the test for infection diseases, heavy metals if it is necessary, and as well urine test. Plus, as for the procedures, it can be done, you know, this day or theoretically the next day. It is a quite intensive regime for the stem cells. The first line, how I have already mentioned, it is intravenous infusion in the dose 3 million per kilo. So if the child is, let's say, 20 kilograms, it means that child will have about 60 million of the stem cells derived from umbilical cord. The same day, one dose with the same umbilical cord stem cells will be done intramuscular, and the dose is 30 million. It is like, you know, a special depot, the special source from which stem cells will be absorbed into the blood flow very gradually. And it is additional dose during this day. Plus, it is supposed to be done the inhalation if the child is cooperative. If not, it can be nasal drops with a double amount. And if we are talking about inhalation, then it will be the dose 30 million of mesenchymal stem cells. And one infusion with the exosomes in dose 2 billion totally, and theoretically it can be done one by one after infusions with the umbilical cord, and additional second inhalation of exosomes. So we hope that child can cope with all these procedures, quite intensive day. So totally, let's summarize, during the day, it will be 2 inhalation procedures, 1 intramuscular injection, and 2 IV infusions. So this is the first day. Then if we move further, you see the second day. It is also inhalation. Yeah, those inhalation from umbilical cord stem cells in the dose of 30 million. The same about exosomes, which will be inhaled in those 400 million, and IV infusion. Sorry, no, it is the end. Sorry, this is the end of the page. It is the second day. Not very intensive in comparison with the previous one, but still, yeah, mostly it is inhalation procedures, like additional booster for not only lungs, but for the whole body, because it can be easily absorbed into the blood stream. Then it goes the third day, and here we see placenta-derived stem cells. Again, the same dose, 3 million per kilo, per 1 kilo of a child, and the placenta-derived stem cells will be done intramuscular, like intramuscular injection as well. The dose 30 million totally, and the cells for inhalation from placenta will be 30 million plus 1 exosome infusion for intravenous administration. 2 billion is the dose. Yes, you see 2 billion is the dose, and additional inhalation with the exosomes. So this day very similar reminds the first one, but here it is mostly placenta derived mesenchymal stem cells, but the idea is absolutely the same. And the exosomes inhalation or nasal drops in dose 400 million. Then the fourth day, like the second day, is not so intensive with the stem cell procedure and with the exosomes for inhalation. Stem cells dose 30 million and exosomes 400 million of the cells. The fifth, the sixth, and the seventh day are pretty similar. One procedure with inhalation or nasal drops with a double amount, and the eighth day is again inhalation and very interesting procedure, which I would like to focus your attention, and it's actually a new product in Swiss Medica. It is using macrophages, we call them. These are cells which helps to clean our body has them. These cells, those are which helps with cleaning body from bacteria, from viral infection, so they can help to in a natural way to cope with any kind of infection. And the idea with this procedure is that first day when the child arrives to clinic with the family, the own blood of the child is taken, and of course blood contains these cells as well. And during these 8 days in our lab, they are multiplied, they are harvested, and when they reach necessary dose, it is the average time like the 8th day, they can be again returned into the child's body. And the effect is first of all anti-inflammatory effect, and we rely on this effect because one of the theory says that autism has certain inflammation in central nervous system, and misbalance of immune system. That is why using of these cells for autistic kids seems to be effective, very promising. And after their harvesting, within this period of time, they will be, one dose will be infused back, IV infusion, and one dose can be inhaled, because as you know, lungs are special filters. It has a huge volume of tissue, and it can be easily absorbed, yes, these cells into the bloodstream, and some will stay in lungs, which is also important. Now, last step of the therapy, and mostly, let's say, post-treatment, which is quite important, is exosomes which parents can use when they come back to clinic, when they return home from this therapy. And we provide the family with nasal drops, which will be enough for 12 weeks. So it is for 3 months period. So for this period of time, with nasal drops, the child will additionally have these support, yes, with the exosomes, like gradual booster for regeneration of CNS. And the dosage of these exosomes for 3 months period is around 240 million. And I remind you that the place where it can be done is in Serbia, in Belgrade, and the cost for this intensive plan is 50,000 euros. Now I see that we have some questions, so I will look. Sorry, I couldn't probably, Mr. Reiner, you can help me with translation.
As Michael is saying that the price is 3 times in Mexico. Orit says she doesn't understand the pricing. I'll just translate for Orit. מחיר אורית זה 15,000 יורו לכל ה8-9 ימים האלה.
איך זה פתאום קפץ ל8-9 ימים? זה היה אמור להיות 5 ימים.
זו תוכנית חדשה, אני לא מכיר אותה. They're asking how come how come the program is suddenly 8-9 days. They've only heard of 5 days until now. So I said it's a new program that even I haven't heard of yet.
Yeah, this is like, expanded plan. And right now, I will, when we finish with this program, I will come to the 5 days more intensive treatment plan. Yeah, so we will discuss today 2 plans for the therapy, okay?
Yeah.
Okay, good. So here, what we have learned, and right now we will...
Excuse me, Dr. Alexandra, could you go back to the 9-day plan, please?
Yeah.
Few things were missed. Well, first of all, this plan can be splitted. Like patients who come following this treatment plan, they can stay 5 days in the clinic. And as Dr. Alexandra has mentioned, the blood will be taken for further macrophage procedures, but it can be done during the next visit. So it goes without saying, for some patients, for some parents, it's quite difficult to stay in Serbia for 9 days. So that's why we decided to give a chance for parents to split this treatment plan for 2 times. So basically, you guys can come to the clinic, do stem cell procedures, and etc. And the macrophages, inhalation, and 1 stem cell procedure can be done a bit later during your next visit. And also, the second thing that I would like to mention is a free checkup and particular physiotherapy, PRP procedure are also included in this treatment program for the mother and father of the child, if it's needed. It's complementary.
What's offered? I didn't understand. Could you repeat?
A free checkup. So a father and mother of a child can have a free checkup in the clinic. Also, they can have a particular physiotherapy, PRP procedures. This is something about anti-aging, let's say some
local procedures.
Yeah, local
Plasma
procedures.
reach the platelets. This is what we are discussing, PRP.
Yes, all these procedures, they can be done for the mother and father of the child, complementary.
Complementary, okay.
Yes. All right, so I think that we can move to the.
Oh wait.
Sure.
If I want to take the 9-day plan and split it into 2 weeks, how far apart should they be?
Yes. Well, so first 5 days. A patient and his parents stay in the clinic. And then on the 6th day, they will be moved to the hotel, and the hotel cost is on us. And so basically we're gonna choose the hotel and we're gonna pay for it. But still the patient, he's coming back to the clinic every day for inhalation, and for the 8th day, there's gonna be macrofax procedures done.
Now, you said something about if it's too difficult to stay in Serbia for
8 days,
9 days.
Yep.
Then we go to a hotel in the break, like 2 weeks apart.
All right, let me explain it one more time. So there are two options. If patients have an availability to stay for 8 to 9 days in Serbia, they're gonna stay 5 days in the clinic, and for the 6th day they're gonna move to the hotel.
Okay.
And every day they go to the clinic for the procedures and coming back to the hotel. This the hotel cost is on us, on Swiss Medica. That's the first option. The second option, a patient's parents spend 5 days in the clinic and come back to Israel and arrange next visit to the clinic and finish all the procedures that left.
Okay, how long should we wait? Does it matter?
This is something that can be discussed in the clinic.
Okay. Okay, I think I'm ready to continue.
But is it like 6 months apart or few weeks?
No, few months.
Few months, okay.
Yep.
Okay, now can I start with 5 days treatment plan? That is what you probably expected, Mr. Reiner, to see. And this is probably like, it has many similar with the 9 days program, but most important thing that makes this program different is the absence of macrophages, that special cells. They are not here within these 5 days. And it again includes diagnostic part, yes, which is done the first day. So diagnostic part, and then it is again intravenous infusion of placenta of first umbilical cord stem cells for IV infusion, the same dose, 3 million per kilo. And you see that these types of cells will be done as well intramuscular. Yeah, so 1 IV and 1 intramuscular injection of umbilical cord derived stem cells. It can be, let's say, 1 day, and the next day or in a day can be the second IV infusion of the stem cells taken from placenta, the same dose, 3 million per kilo, and one of this type of MSCs can be done as well intramuscular injection. we just have additionally exosomes breathing, exosomes inhalation of the stem cells in dose 400 million. If the child can't have inhalation, it can be like usual nasal drops with double dose. Okay, and so this inhalation can be done 2 times, and just between IV infusion and intramuscular injection. And then, so 2 times, you see one procedure is 1 day, and it can be the second day or in a day additional inhalation of the stem cells. And for, you see, for further part for post-treatment, we provide exosomes for nasal drops that parents will be take home. Yeah, it will be 5 bottles of exosomes that will be enough for 1 month period. Yeah, for 1 month period. And here you see the cost for this 5 days treatment plan, 11,000 euros. And yeah, and as well, it is done in Serbia, Belgrade. So it is a much more intensive regime of the stem cells, which families with autistic kids can have right now. You see the differences with additional intramuscular injection, with exosomes inhalation, and the package post-treatment with nasal drops.
So what is the overall amount of cells they're going to receive in this treatment?
Well, let's calculate it together. Let's take a child of the age 4 years old, for example, with weight 20 kgs. Yeah, it means that a child will have 60 million with 1 IV infusion. Totally, there are 2 of them. So it means during 5 days for IV infusion, it will be about 120 million, correct? So 1 dose, 60 million, 2 doses, 120, plus 30 million with intramuscular injection, and they will be done twice. It means 180 million, yes, totally with IV and intramuscular injection. And here it is calculation of exosomes. So let's say totally it will be 160 million for injection, and for inhalation around 800 million of exosomes, plus exosomes for nasal drops 100 million to take at home. This is a plan with all stem cells and exosomes, the amount I mean.
סליחה, אני לא הבנתי עדיין לגבי התשלום, אם זה רק 5 ימים, כמה התשלום? אני מבינה שאם זה ל9 ימים זה 15,000, ואם זה ל5 ימים כמה זה?
אז רשום פה 11,000. The 5-day plan is 11,000 euros.
Yes, yes, you see it. And as far as I remember, probably my colleague Alex can correct me, it is in case if there's a big group of children will come, not just to sell it separately, yes, for each patient family, but when the group will come and it is arranged. Is it correct, Alexei?
Yes, that's right. This treatment plan works for a group of 20 patients per month.
So if we're taking the 5-day plan and only individually, it will be 15,000?
Yes, that's going to be 15,000.
And what about the 9-day plan?
Yeah, that's what I'm talking about. So basically there are two treatment programs, right? The first one contains 8 or 9 days staying in the clinic with extended treatment procedures. And this one is for 5 days. So the first one costs 15,000 euro. This one is 11,000 euro. Mm-hmm. But this one works with a group only.
Okay, but it's the same cost for if I go individually for the 9-day plan as well?
You mean 15,000?
The 9-day plan, how much would it cost if I'm coming individually without a big
15.
15?
Yeah.
So 15 or 15 is for 5 days or 9 days, it's the same price?
Yes, but if you, as I tried to explain you guys last time with this 9 treatment plan, macrophages procedures, some stem cell procedures and physio, they can be done a bit later when you come back within a few months to the clinic again. So that's the difference.
I don't understand. I get a lot more treatments, a lot more cells per kilo, but I pay the same price if I'm coming individually for a 5-day plan or a 9-day plan, or it's, I don't understand the pricing now.
So in comparison, like if we compare these two treatment programs, 5-day and 9 days, we can see that the second one, 9-day, it has much more procedures inside.
Yeah. So why is it the same price?
No, it's 15,000. But if you guys
if I come individually and I want the 9-day plan, is that possible?
Yes, absolutely.
And what would be the price if I come individually for the 9-day price?
15,000. Haggai, 15,000.
But then,
so a 5-day treatment plan, that's the only plan for the group of 20 patients. That's why the cost is decreased. It's 11,000 euro. A 9-day treatment program costs 15,000 euro, and it can be done individually, as you said.
אני קראתי שארז, נדמה לי קוראים לו, כתב שהוא הגיע איתם להסכם של 10,000 יורו.
זה לא נכון, הוא כתב משהו שהוא לא הגיע איתם להסכם.
מה?
They're asking about the other group, Ran Erez, if he's come to any kind of agreement. Is that something that he has a different pricing?
No, Mr. Ran, he had a chance to talk to me. I told him initially that we are preparing new treatment programs for you guys, for people from Israel, but he doesn't have any offer from us. He doesn't have anything in details.
Okay.
לא, משונה.
אז הוא ניסה לייצר תוכנית מיוחדת עבור הקבוצה שלו, והוא לא קיבל את זה. הוא פרסם שהוא מקבל, ועכשיו הם אומרים שבגלל שהוא לא ניהל איתה משא ומתן כמו שצריך, אז הוא לא קיבל את התוכנית שהוא פרסם שיש לו.
לא, הוא פרסם שהם רוצים 5 אנשים כל פעם.
אז גם זה מה שהם אומרים אצלנו, והוא אומר שהוא לא יכול להתחייב לזה, ובסופו של דבר כנראה שהמשא ומתן של רן ארז מול החברה פשוט לא יצא לפועל. הוא לא קיבל את התנאים שהוא פרסם שהוא הולך לקבל.
זה היום הוא כתב את זה, מעניין.
הנה הנציגים מולך.
אז רגע, אם אנחנו לא נהיה 5 אנשים, כאילו קבוצה, אז זה יהיה מחיר אחר בשבילנו?
המחיר הזה של התוכנית, רק שנייה, אני יוודא מולה. So this plan that we're looking in right now, 11,000, is if we come in a big group. So that's 20 people in 1 month.
In 1 month.
And then the 15,000 euro plan, the 9-day plan, I can take that individually, whether or not it's a group or it doesn't matter.
Doesn't matter.
Okay.
And they will both cost the same, 15,000?
No, if you guys found a group of 20 patients, each of you will get this 5 treatment plan for 11,000 euro.
Yeah, I understand. But if there is no group, okay, and I want to come individually, I can choose for the same price of 15,000 to come for 5 days or come for 9 days?
Yes, that's correct.
Okay.
מה? לא הבנתי.
את יכולה לבחור תוכנית של 9 ימים, יותר טיפולים, באותו מחיר של התוכנית של 5 ימים, ופחות טיפולים.
למה? זה 15 ולעומת 11.
לא, אז ה-11 זה מחיר רק אם אנחנו מצליחים לגייס קבוצה של 20 אנשים בחודש. הבנת?
ואין, לדעתך אי אפשר יהיה לגייס?
אנחנו יכולים לנסות כקבוצה, יכול להיות.
אז למה שלא יעשו מחיר גם ל9 ימים אם נהיה קבוצה? להזיל את ה-15 כי זה יוצא המון.
זאת האפשרות, לדעתי אבל יש עוד אפשרות. There's another program?
No, basically we have these 2 treatment plans for you guys. Yeah. Also it's possible to choose, like we can stick to the previous treatment plan for 3 days, but it has only 1 stem cell procedures and exosomes.
And how much does that cost?
7,000 euro.
7,000.
Yep.
אז יש 3 אפשרויות. אחת תוכנית של 3 ימים, אחת תוכנית של 5 ימים, התוכנית של 3 ימים ב7,000 יורו, תוכנית של 5 ימים ב15,000 יורו, או ב11,000 יורו אם נצליח להתארגן כקבוצות של 20 איש בחודש, ותוכנית של 9 ימים ב15,000 יורו, שמקבלים בה יותר מהתוכנית של 5 ימים.
גם בתוכנית של 3 זה הכי פחות, כאילו הכי פחות מקבלים ב3, אז זה לא שווה. אם כבר נסעת, עדיף לקבל כמה שיותר.
שוב, השאלה אם זה לא שווה באמת, כי אנחנו עשינו תוכנית של 3 בפעם הראשונה שטסנו, והיו תוצאות.
אוקיי.
אז השאלה אם באמת זה לא שווה, אני לא בטוח. יכול להיות שעדיף ללכת על תוכנית של 3. אנחנו ראינו תוצאות, הפסקת פרקוסים ב3, התחלה של דיבור ב3.
הבנתי.
אז
צריך לחשוב על זה. הם יכולים גם יש לך את התוכנית של 3 ימים לפרסם את זה?
אני אבקש.
תודה.
When we finish, I'd like to receive a copy of these plans and also the 3-day plan so people can have the choice. Now, a question for the doctor. Is there any indication which plan is better, which one I should choose? Is a 3-day plan not good, or is it also good?
You know, I can tell you in such a way that, of course, quantity and quality of the stem cells is important. And if we do the only one procedure, I think it is the best way for those patients who don't have additional financial support and enough time to come and try at least one procedure. You know, and especially probably it is a case when we are talking about kids who are also over than 11, 12 years old, when chances are quite low to activate neuroplasticity, but still, if family wants, why not to try at least with one procedure? And as for me, this new option with macrophages cells, it seems to be very interesting, and there are some publications confirming effectiveness of this therapy for autistic kids. So we will start this project, and I hope that you know, results will be better. So as a doctor who has already seen results from 5 days therapy, yes, with the exosomes, with 2 IV infusions. Now we are at the new era of using macrophages, and of course I recommend parents to include this option into the therapy, because it will be additional chance to reduce inflammation. And as you know, we with our doctor, yes, just we discussed our own article, medical article, yes, confirming that previous treatment is effective. Now new one seems to be more effective, and who knows, it can bring much more benefits to a kid. So we hope that it will happen. We believe that it will happen.
Is it
You
okay
already
to ask
tried
you
this?
Sorry. Is it okay to ask you to send us the article so we can share it in the group?
I think yes, about macrophages, yeah.
Agil had a question.
Yeah, hi. I just wanted to ask, the new procedure you're doing for the 9 days, did you already start running it? Did you see any results?
We haven't started it in our clinic, but we learned the results, which we will share with you. Yes, that some clinics used macrophages for kids with quite good results. So we will share this information. And now we are in process of launching, of starting this project with macrophages.
Great, thank you.
אז רגע, אז השלושה ימים כמה עולה?
7,000.
7,000?
7,000 יורו.
ובעצם אין, טוב, ל5 ימים אני לא מבינה למה זה כל כך יקר 5 ימים. אז כאילו הם מכריחים אותי לקחת את המחיר של 9 ימים.
אלא אם אנחנו נצליח להתארגן בקבוצות של 20, ואז יש 5 ימים ב4,000 יורו הנחה לכל אחד.
אבל זה כל חודש 20 אנשים יגיעו, זה קצת הרבה מדי לדעתי.
יכול להיות, אני לא יודע, אנחנו ננסה בתור קבוצה לבדוק מי זה מתאים לו בתוכנית הזאת. זה רק בחודש שיסכימו, אם אני מבין נכון, זה רק בחודש שיסכימו 20 אנשים להירשם לתוכנית של 5 ימים.
אז עושים הנחה לקבוצה הזאת של האחות בחודש הזה.
נכון?
אוקיי.
Okay. Does anybody else have any questions?
לא, אני רק מקווה שתכתוב איזשהו תקציר בעברית, כי היו פה הרבה מילים מקצועיות שלא היו כל כך מובנים.
אני אסכם, אין בעיה.
תודה רבה.
תודה. Thank you.
Okay.
Thank you very much. Thank you.
Thank you.
And yeah, we'll share information from our side with these 3 plans. Yeah, we will send it to you. And the articles, medical articles connected with the macrophages, different trials and results.
Okay.
Okay?
I'd like to ask before we finish, these were the programs for children with autism. We also have people in our group with epilepsy, CP, adults with Parkinson's, maybe MS. What kind of programs would fit for other conditions?
You know, mostly for, let's say, neurological patients, adults, we definitely have the injection into the spinal liquid, yeah, and it is stem cells taken from bone marrow to achieve in a maximum way the central nervous system to achieve neurons and to activate neuroplasticity in spite of the disease. It can be Parkinson or even MSA disease or any other, yeah. And plus it can be intramuscular injection because of changes with the muscles and changes reducing of neuromuscular conduction. Plus it can be also nasal drops and inhalation, and of course intensive physiotherapy, because adults with neurological problems, they need it. They need this support, not only the stem cells therapy, but plus infusions, plus physiotherapy. This is mostly what we have. For MS patients, it is usually common final outcome -1 point according to a DSS score. What it means, if to say in a simple way, patients feel better, they have more energy, more stamina, and their neurological symptoms are less. It's not full reverse, but at least it is some kind of improvements they can additionally have. With more severe form of the MS, when it is, you know, like quite severe symptoms, the same about Parkinson, dementia, and other problems. Mostly then it is stabilization, especially if people are old enough and the regenerative capacity of the body is low. So we, in most cases, we observe stabilization of their symptoms. So let's say the disease is frozen for, it can be 1 year, sometimes more or less, you know, period of time, but at least it makes life expectancy longer as well. And if to speak about, you know, cerebral palsy, unfortunately, not great results we could achieve, but in some cases, relaxing of spasticity, reducing of spasticity, and improvements with cognitive function, not great changes, but some kind, you know, and what I would like to say that children have less episodes with the infection. So immune system in reality is much stronger, and for some countries it is good not to have very often infections. So this is like common results. And, you know, if to say about each individuals, of course, we need certain information. We ask video, like we ask it for autistic kids, the same about all neurological patients, to understand their current condition. It's very important not to have such problems with swallowing, with breathing. You know, I mean, the patients should be compensated, because if the disease is too strong and like last stage of the problem, then in some cases we even say that at this stage we can't do anything, and just we can't help.
Okay, so in order to get to Swiss Medica, we need to send the medical file. The doctor will assess it and decide if there's a treatment plan that can work. If for autism, it's just the assessment that there's autism. For other conditions, they need whatever relevant medical documents they have. And yeah. Then for other conditions, the programs are more flexible. According to what the doctors think that the patients will help.
Yes.
Okay.
I think that if it's a severe condition of the patient, it also can be requested a short video from our side.
Okay.
I mean, to get a short video from the patients.
Mm-hmm. Regarding the, I forgot what I want to say. Some patients have cord blood, whether autologous or maybe sibling cord blood stored in Israel. I've recently found out through a company called World Stem Cell Clinic. World Courier, that it's possible to get cord blood into Serbia. Will the clinic allow treatment with, let's say, autologous cord blood or sibling cord blood? For autism, for CP?
You know, of course, it is possible, but at the moment we are at stage of clarifying what countries can deliver the stem cells. It depends on the bank to the Serbia. So right now, I'm not ready to answer these questions, because we are in process of analyzing which banks, because stem cells can be stored in different banks, and some of them can't deliver them to Serbia. I don't know.
From what I've found out, it's currently possible. The question was if we can get the cord blood to the clinic, your clinic will use it to treat a child?
It can be used. Our lab, our specialists can do it, yeah, but just only to be sure that there won't be problems with the delivery. So that is why finally I can't tell you about these technical issues, if it's possible or not with some countries.
Okay. I had some questions from previous sessions regarding the quality of stem cells. What kind of process do the stem cells go through in order to ensure that they're safe?
Well, it is, as I was explained it by our biologist who does this procedure by herself. Twice the material is checked for infection diseases according to all European protocols, as those patients who had already had the therapy in the clinic. It is AIDS, hepatitis, Epstein-Barr, cytomegaloviral infection, so hepatitis, I've mentioned, tuberculosis. So common problems, which infection problems, which any biological material should be tested.
Anything else? Is there like which kind of, how many passages do the cells go through? Are they grown out to check for mutations? Are there things like that?
Well, as you know, to common standards, it's no more than the 5th passage. It is like in all labs, it is like a rule. Mostly, it is the 3rd passage, what we are discussing right now. Sometimes, yeah, mostly the 3rd one, as our specialist explained to us and taught us.
Okay. In previous other clinics told us that one clinic said that they grow the samples up to passage 30 to make sure that there's no mutation. Another clinic said that they do oncogenetic tests to make sure that there's no risk of cancer. Besides the tests that you've said, are these kind of tests done on the cells, or they're not important at all?
You know, according to many trials which were carried out, as for possible oncological transformation, it is mostly common when we are talking about passages which is over 5 and over, about that uncontrolled splitting and abnormal division. That is why all labs cannot use cells in their practice for people for which have passages after 5th. So in our practice, we don't use those passages at all. Yeah, and as for additional tests for oncological things, I can clarify with my colleague who is doing it every day with her own, you know, just this is her job, what she does. Okay. And I will let you know about these specific tests if it is necessary to do with this 3rd passage or not.
How long do the cells stay frozen in cryogenesis?
Well, you know, cells can be stored in a frozen condition for decades, not changing their properties. Because we have too many patients, so we don't have such cases when the cells were frozen for 5 years, for 10 years, because we have too many patients. Yeah, not to have them frozen for a long period of time, but even for 2-3 years, you know, the properties of the cells don't change. So they can be used after 50 years, etc. But we don't have such material, yes, which is kept for this period of time.
Okay. I think that's all of...
סליחה רגע, אז האימהות בעצם שתורמות עוברות את כל הבדיקות הרפואיות האפשריות,
הן עוברות פאנל של בדיקות שהוא סטנדרטי לעשות כשעושים תרומת רקמות. זאת אומרת, בודקים אותם לזיהומים, ל-HIV, הפטיטיס, כל הזיהומים והמחלות הוויראליות הסטנדרטיות, לפי התו תקן האירופאי.
ומחלות גנטיות וסרטן?
לא, זה היא אמרה שהיא תשאל את הלבורנטית.
אוקיי.
צריך לחזור אלייך לגבי זה.
אוקיי.
Okay. Does anybody else have any questions in the crowd? I finished.
Okay, then. Thank you very much for your time, for your questions, for your interest to this topic. And probably if some questions appear, you will let it know to my colleague, to Mr. Alex, and yeah, we can proceed then and can have additional meeting.
Okay. Thank you very much.
Thank you.
Thank you,
guys.
Thank you.
Bye.
Thank you. It was a
Bye.
pleasure to meet you. Enjoy your day. Goodbye.
Bye.